Hello and welcome back to the Matrix Green Pill podcast. I'm Hilmarie Hutchison, and today I am so honored and excited to introduce Dr. Aarti Javeri Mehta, a distinguished internal medicine specialist, a member of the Royal College of Physicians, and a board-certified lifestyle medicine physician. She is the founder of Sustained Health in the UAE, a holistic program focused on physical and mental wellness, and a passionate advocate for evidence-based compassionate healthcare. Aarti, welcome and thank you so much for joining me today.
Thank you so much for having me, and your words are too kind.
Well, I'm really excited about this topic, something that I'm really interested in. Could you start by telling our audience a little bit about you, your background, and how you ended up in the UAE?
Yeah, of course. So I grew up in Europe, lived a very slow-paced life, decided to go study medicine in the UK. I grew up in the 2000s where the skinny era was really in. I'm not sure if you remember that. But growing up as an adolescent in Europe at that point in time was challenging because I didn't really realize it then, but that kind of era did have an impact on me, how I viewed health, went through my own challenges of kind of disordered eating patterns and struggling with an eating disorder. Thankfully, organically came out of it and decided to go to med school and learn more about the human body. After med school, after living in the UK for about 6 years, I moved on to practice in India, where I realized that there is so much more to medicine than what we're learning in the books. There's an entire cultural aspect behind how we view health. There's community differences, there's social differences. And that's where I really started realizing that, hey, chronic diseases are so prevalent in the MENA regions, it's so prevalent in Asia, where we're seeing things like diabetes and obesity and high blood pressure and ischemic heart disease. All of these are so tied back and so intricately linked. And they're so linked to not only environment, but also genetics. And that's where I started kind of coming across women and patients who also struggled with disordered eating patterns and also struggled with their weight and struggled with food and how they view health. That's where I realized, a change really has to be made. We need to get to the bottom of it and start understanding. We are just giving patients prescription after prescription after prescription. They're coming back 3 months later without a change in their blood parameters. We need to start focusing on the root cause, which is the lifestyle. I've probably unknowingly been practicing lifestyle medicine for about a decade, but I decided to board certify in 2021, and I've never looked back since. And it's the only way I practice with my patients now. So it forms the base and the foundation of a lot of the work that I do with patients.
You mentioned the skinny era. I remember people always saying there's no such thing as being too skinny. But as you say, you've had the benefit of having been raised in Europe, studying in the UK, and then going back to India and observing all the cultural differences, the environmental differences, the genetic differences, and how that has an impact on one's health. I think that a lot of focus maybe on Western medicine is to have a big focus on drugs and just prescribing prescription after prescription, as you say, rather than saying, can lifestyle changes have the impact that we need to see to make a difference in someone's health? So I love that you've got that view of the different influences on one's health.
I do use allopathy. I think allopathy is very much required where it's required. It's not something we can live without. But I do think that we're grateful also to be in this region where we're becoming a lot more vocal about the power of lifestyle medicine, and you see it more and more so now. And we also see that because we're living in a space that is so diverse in the UAE, where there are so many expats, we really get to see so much diversity in terms of conditions, but also the lifestyle-related factors that contribute to disease as well.
So I think you've answered this question, but I'm just going to ask it anyway. So having seen all the different forms of or the different ways of treating diseases, what led you to specialize in lifestyle medicine and endocrinology?
I specialized in lifestyle medicine because I realized that that is the first and the foundational step for managing any chronic disease. And I think it's a big myth that lifestyle medicine is something new. It has actually been around for decades. If you look at our medical guidelines, whether it's related to high blood pressure or obesity or diabetes, or even conditions like polycystic ovary syndrome, the first and the foundational step for managing any of these conditions is lifestyle medicine, but it's just simply not taught in medical schools. So I kind of found the need to go back and to build that basis, build that foundation so that we can provide patients with the care that they deserve and require.
In my notes, I've got it's an emerging field in many parts of the world because, as you say, it's not the first stop when looking for a solution. But for people who don't understand what you mean, could you explain what lifestyle medicine entails and why you believe that it's crucial for managing chronic conditions?
So lifestyle medicine is an evidence-based field of medicine, and it focuses on basic pillars. These are nutrition, movement, sleep, stress management, connection, and substance abuse. So when we're focusing on these kind of 6 pillars, what we're trying to do is optimize your parameters or optimize your behaviors in each of these pillars using evidence-based guidelines and evidence-based medicine. We know that there are particular ways of feeding yourself and moving in a particular way and ways in which we can optimize sleep, stress less, be connected to your environment, also that it improves your overall health, your well-being, and at the end of the day, longevity as well.
What inspired you to establish Sustain Health in the UAE, and how did that reflect your philosophy on holistic well-being?
So Sustain Health is a platform where we focus on providing patients with behavioral change interventions and lifestyle medicine programs to improve outcomes. We focus on 4 pillars: a sense of accountability, because I think this is commonly missing out; education, I believe education is king; science and innovation. So we really focus on evidence-based medicine and community. The reason why I built this was I found that these 4 pillars were what's missing in a patient's care. You need all 4 of them to come together really nicely in order for you to be able to achieve kind of your optimum lifestyle so that you can achieve optimal health.
So walk us through the process of somebody finds you and is interested in this services, I guess, you provide. Let's talk about that.
So what we do is we go through a full lifestyle and medical evaluation. We obviously perform blood tests, genetic tests if required, proteomics testing if required as well, where we can really start understanding and personalizing and risk stratifying you so that we understand what your specific risks are when it comes to conditions, whether that's your lifestyle or medical conditions. Then what we do is we develop personalized programs. It's really important to understand that not one patient is the same from another, right? Every single patient that we have is unique. Your lifestyle is unique. Your gut microbiome is unique. And kind of using a blanket approach to managing patients doesn't work. So we provide 12-week, really structured, intensive programs to address each of those pillars of lifestyle medicine: nutrition, movement, sleep, stress, connection. And we have a very strong positive psychology component to them as well. A lot of the work that we do is based around positive psychology because we believe that you shouldn't be focusing at the place of deficit when it comes to your health, but thinking about how you can flourish and how you can get to positive and how you can understand and embrace your health with a mindset of abundance so that you can improve outcomes. And when we go through these behavior changes over the course of 12 weeks, we do it in a way that is very non-restrictive. I don't believe in diets. I don't think they work. 90% of diets fail. I think it's very easy to yo-yo, and especially if you have disordered eating patterns, or, if you're a woman kind of going through, and this is what we do a lot with women, we deal a lot with women who have polycystic ovary syndrome or in perimenopause. And those are really, really tough phases and periods of your life. And they're tough conditions to deal with when being on a diet just makes things worse. So we really take on a non-diet approach to help patients kind of manage their health. They go through those 12 weeks and then we have end blood reports and blood analysis to see how they've improved. And then we provide them with accountability and community, a sense of community so that they can be followed up over a long period of time. The biggest thing we're trying to do is to co-create plans with patients so that we can provide them with results that are sustainable. For me, it's not about perfection. It's not about transformation. It's about really understanding where you are at with your lifestyle, where can you get to, and how are we going to get progress every single day without getting into the mindset of all or nothing.
I love that. So during the 12-week program, do they personally come in and do a check-in with you on a weekly basis and then go back home and implement the strategies you discuss?
We have different checkpoints during those 12 weeks, depending on the kind of medical conditions that there are. They're either once a week or they're once every 2 weeks, but you have accountability with myself or a team member, a health coach during that course of this 12 weeks whenever required. So we're really there as your SOS. So I always tell my patients, the more you ask me during those 12 weeks, the more you get out of it. The more you're kind of in touch with us over those 12 weeks, the more you get out of it, because that's really your point in time where you're trying to understand your body, learn your rhythms, understand yourself, and understand the symptoms that you're experiencing as well.
And these programs, they're not necessarily for somebody with diagnosed diabetes or a diagnosed condition. Anybody who's concerned about their health, wants to improve, can come and do these programs.
Yeah, of course. So we have the healthy as well, who want to get healthier or who want to optimize their lifestyles so that they can kind of improve their overall health and longevity. Then we obviously have patients who are sick who require the help as well.
Let's talk about diabetes a little bit. Diabetes distress is a growing concern globally. How do you help patients manage this emotional and psychological burden effectively?
I think diabetes distress is a topic that is not talked about frequently, but one that needs to be talked about a little bit more. It's the sense of, like you said, a physical, psychosocial burden of having diabetes. And we found that the biggest kind of things that help this is to ensure that you have a multidisciplinary team to manage your diabetes. I mean, your doctor who's in touch with a diabetes educator, having diabetes self-management classes or diabetes education classes really do help to reduce distress. We know that from studies as well. They help to reduce HbA1c, and they also help you to feel a little bit more supported during your journey. So I think having the multidisciplinary team is important. The second is having regular communication and a team that you can lean back on or fall back on when you're concerned, when you have questions, when you're unsure of what's happening with your diabetes journey. I think those are the very important things that you can touch on. And the third is having a lifestyle medicine physician on board so that you can look at overall, what's your diabetes picture or what's your diabetes care pathway going to look like when it comes to the pillars of lifestyle medicine?
Excellent. You mentioned earlier on also about disordered eating. Can anxiety around managing diabetes lead to disordered eating? And what steps can patients take to develop a healthier relationship with food?
I think this is something that's really important for a patient and a doctor to speak about from the get-go and from the beginning of one's journey together. Disordered eating, you're right, can become prevalent, especially when you are getting a lot of anxiety around blood sugar readings. And I think it's really important that you find a nice balance between how many times am I going to check my sugar and how many times am I going to actually become obsessed with or be worried about the food that I'm eating to the point where it's leading to disordered eating. And in that case, it may be that, hey, we're not going to check your sugars as frequently. What I commonly do with my patients, and the ones especially that I know are a little bit more anxious around blood sugar readings and their food, is I won't focus on daily trends. I will focus on patterns. I will give them a little bit of a break time or time off from recording their blood sugar levels. I may actually not use recording blood sugar levels for quite a long period of time until we've improved their relationship with food, and then go back to ensuring that we've got the blood sugars in order. Obviously, this is for patients who have blood sugars that are relatively well controlled and they're not very high.
Right, because that anxiety around food can actually trigger you to want to eat more because you're also stressed about it, rather than have a sort of a more calm relationship with food. Many people believe that they are destined to develop diabetes due to their family history. How do you explain the role of epigenetics and lifestyle changes in preventing type 2 diabetes?
So we know chronic conditions develop for multiple reasons. Okay, we have the genetics. Yes, it is one part. And the second is environment. When we're talking about environment, we're talking about how you've grown up. We're talking about your lifestyle. So all these pillars of lifestyle medicine, we're talking about toxins in the environment. We're talking about this multifactorial picture that is either predisposing you or not predisposing you to develop diabetes or develop other chronic conditions. With the concept of epigenetics, we are basically able to make changes in your lifestyle. So whether that's eating healthier, moving more, sleeping better, managing your stress, being more surrounded with loved ones, these kind of positive changes have actually been shown to switch off certain genes that are involved in progression or worsening or even development of diabetes. So this entire myth behind I'm destined to get it because my family has it, or I'm going to get it because everyone in my family has diabetes is just not true. We can make changes to your lifestyle so that you can prevent, reverse, and treat diabetes.
Good to know, because then if you know that there is other ways to deal with it and you're not destined to get it, you can make those changes to possibly not end up getting type 2 diabetes. It's overwhelming how many things can impact one's health. You mentioned the lifestyle, the conditions around us, our environment. If you live in an apartment that has mold, for example, that can impact your life. So there's so many things. If you had to give our audience 3 things to look at first, what would you say would make the biggest impact in the shortest period of time?
You've all heard eat healthier, move more, sleep better. That's not the kind of advice that I want to give my patients. It's about changing mindset. So instead of focusing on an all or nothing mindset, which is something that I commonly see with my patients, especially my women, right? It's going to be the New Year's. I'm going to start next year. I don't need to start this year. And then I'll be so on it from next year. And then what happens 2 weeks later is that you're off that diet. So instead of adopting an all or nothing mindset, I would say adopt a mindset of progression over perfection. Realize and recognize that it's the small steps and those mini steps and those mini habits that really culminate to make big results. The second is adopt a mindset of abundance. I think with social media and with the lifestyles that we're living nowadays, we always tend to adopt a mindset of kind of restriction when it comes to foods or when it comes to exercise or when it comes to any of these things. But I think if you can adopt a mindset of abundance and recognize and realize that you've actually got so much in your environment, we're really lucky to be living in a place like the UAE where people have become very health conscious, and we do have a very fit city here and a fit country. We are able to make those changes, and we can make small changes that culminate to big results as well. And the third is provide yourself with self-compassion. Even if you have been diagnosed with a medical condition, provide yourself with that compassion. It is okay to feel tired some days. It is okay to not be 100% some days. It is okay to not be 100% on it when it comes to the food some days. But the more you provide yourself with that, the more you'll find yourself come out of that shell, and you'll be able to flourish and to prosper, even if you do have a medical condition.
I love that. That's excellent advice. It comes down to mindset, as you say, progression over perfection. I love that. Adopt a mindset of abundance. We do have a lot of resources in the UAE that we can tap into, and then self-compassion. And what I love about this is it applies to everyone, no matter their age, because we know as women age and you go through menopause and perimenopause and all that, your body also changes. This mindset can also have positive effects for women that's in the menopause stage of their lives. Would you treat women who are older differently to other patients?
I think there are massive changes that women go through during different stages of their life. And I think it's really important to treat them in a way that is unique and different during that stage of perimenopause. Their requirements are different. They change slightly. Going back to your question, we can't treat everyone the same. As you go through those years of perimenopause, it's important that certain conditions get flagged up a little bit more, or certain symptoms get flagged up a little bit more, because all of these are indicators of hormonal health.
I want to just track back to something you mentioned earlier about people who might become stressed over their blood glucose levels, because there's a lot of debate around continuous glucose monitors. Do you think all diabetes patients need one, and could it sometimes do more harm than good?
The simple answer is no, not all patients need them. I think it's really important for us to realize and recognize and become aware that blood sugar spikes after meals are normal, they're required, and they're physiological. And this is especially for someone who doesn't even have diabetes. Obviously, we need to think about how often it's happening. What are the spikes going to? How long are the spikes staying high for? And that's kind of when we start dealing with, are your blood sugar levels higher, or are we dealing with a prediabetes or diabetes? For my patients with diabetes, I pick and choose who requires the CGM monitors. They're fantastic for some people because they really allow you to understand how different parts of your lifestyle and how your medications are affecting your blood sugar levels. They're really futile if you're just putting one on without really understanding the effects of your lifestyle or the outside factors, whether it's medications, on those readings, right? So you need to be working with a healthcare professional to make sure that you're gaining the most out of putting on that monitor. I will not use it for patients who get overly stressed about their readings, who are having sleepless nights because they've got spikes at some points. I will not use it for patients who have disordered eating patterns or those who refuse to eat things because of the spikes, or even if they are restricting their foods to huge amounts, because you're right, it does cause a little bit of health anxiety in some.
Excellent. But for those where it does not cause that anxiety, there is a lot of benefit to be able to.
Exactly. There is a huge benefit. It's also important to realize that, look, there is going to be a variation between a finger prick and the CGM. So for very high or very low sugars, we still do need that finger prick test.
Very, very interesting. Well, this is a fantastic subject to talk about. So much to learn. I love that you've taken this holistic approach, a lifestyle approach, rather than just prescribing more medicine to patients. And it sounds like your 12-week program will help people change their mindset rather than just a short, quick fix to lose 5 or 10 kilos. I love that. Now we've come to the segment of our show where I'll ask you some rapid fire questions, our version of a game show. Are you ready?
Sure.
What is your go-to comfort food?
Nutella?
Wasn't expecting that. You've lived in many countries. Do you have a favorite vacation spot?
My favorite vacation spot is Botswana.
Oh, lovely. Do you have a favorite health tracking device?
I use Apple Health. I turn to it for everything. I think it's very, very user-friendly and convenient.
Super. What is one thing you do every day, no matter how busy you get?
I journal.
Very good. Well, thank you for playing along. That was easy enough. Now we've come to our signature question about your green pill moment. What green pill advice would you give to your younger self?
Don't be afraid to not fit in the box. Try to be daring. Start, pivot, fail, try again. Give yourself that trust and trust that you won't have the answers at the very beginning, but keep trying. You don't need to be on the path that everyone else is on.
Excellent advice. And I'm sure our audience will benefit from that advice as well. Thank you so much for sharing your story with us today. For our audience who would like to get in touch with you, could you please share where they can find and follow you?
Sure. My Instagram handle is Dr. Aarti Javeri Mehta. You can always DM me and I'm available through there.
Brilliant. Thank you so much. It's been excellent talking to you. I love your approach to health. I think that's absolutely brilliant.
Thank you so much for having me, and your words are too kind.
And to our listeners, don't forget to follow, share, and like to stay connected with us for more enriching conversations. Until next time, take care and keep pursuing your dreams.
If you enjoy our conversations, please like and subscribe. See you next Wednesday.